مؤخرا أعلنت حكومة أونتاريو حزمة من الإصلاحات وخطة من 3 مراحل للقضاء على التراكم والصفوف والانتظار في القطاع الصحي، خاصة قطاع العمليات الجراحية. خطوة جيدة للغاية عندما ذكر داك فورد أنه سيتم القضاء على انتظار 14,000 حالة من منتظري إجراء عمليات الكاتاراكت في العيون، وهي عمليات لا تؤثر على الحياة ولكنها توقف الحياة. أصدقائي المشاهدين في كل مكان، يسعدنا أن يكون معنا الليلة MPP روبن مارتن, the Parliamentary Assistant to the Minister of Health in Ontario. MPP Ruben, thank you for your time and welcome to Hawa Toronto.
Thank you so much for having me. I'm delighted to be here with you. Well, I'm delighted to do that, to speak about healthcare in Ontario and what our government is doing to try to make improvements to healthcare in Ontario. So important to all of us.
Absolutely. There has been a lot going on, especially about privatizing the health sector or forgetting about the OHIP card. Let's first start with this because we have to hear it from you. Is it really privatizing?
No, I think, unfortunately, we have a debate sometimes in Canada because the parties, I guess, decide to focus on that issue. And I would prefer that nobody uses the word public or private in this discussion. And that's what the government's been trying to do. We've been saying, the Premier's been saying, the Minister of Health's been saying, I've been saying, you will pay with your OHIP card, not with a credit card. So everything you get now with your OHIP card, you will get with your OHIP card in the future. We're not changing that at all.
As well. We also need to be clear, Ontarians will always access the health care they need with their OHIP card, never their credit card. Our goal is simple.
And so what confuses people is what they mean by public or private. And you know, Dr. Jane Philpott, who was a Liberal former federal minister of health, she said, these words don't help us. We shouldn't use these words because they just confuse people. So I would ask all of your listeners, when they hear those words, to try to focus on what's really being talked about, because honestly, they are not, that doesn't help clear things up. If all you care about, I think all your listeners care about, is when you go to the hospital, are you going to be charged? Or when you go to a clinic, are you going to be charged? Or do you pay with your OHIP card? And we're not changing that. You pay with your OHIP card.
So obviously we are adding more spots, more places, more clinics, more facilities into the system just to reduce the waiting time and the whole way medicine that we've been really suffering from years.
Absolutely. We need more, right? We need more care. And so our plan that we announced today has 3 pillars. And the first one is right care in the right place, which is something we have been working on since 2018 when we first got elected. That's why we're building up to 60,000 new long-term care beds, building 30,000 new and upgrading 28,000, which will be ready by 2028. But we've already got a lot coming online now. That will help get one of the biggest groups that are stuck in hospitals that could have better care in the community back into the community, into those long-term care homes. We've put money into mental health and addictions as well. We made a promise of $3.8 billion over 10 years. And we've already got annualized more extra funding of $525 million every year for mental health and addictions services. Recently, we announced the one-stop talk for youth and youth wellness hubs. We've added to the number of youth wellness hubs. So all of this is helping to take pressure off our hospitals and to have more care in more places in the community, like you said.
MPP Ruben, maybe lots of your voters in your riding have come up and maybe when they met you after the news, every time there is something about the health, they mention something about the term or terminology overselling. First of all, I don't know Who came up with overselling? Well, how you elaborate on that?
Yeah, so I think what people are concerned about is that in these new clinics, one of the small concerns that people are raising is the one you said, is will they be charged more for a cataract surgery there? Well, they're not going to pay with their cash. They're going to pay with their OHIP card. Now, there is, as I understand it, I've never had a cataract surgery, but when you go, sometimes your doctor will say, this is the OHIP provided lens, but we have this new super duper lens, and you could get that one if you pay extra. But this happens in hospitals as well. So if somebody has their cataract surgery in a hospital, the ophthalmologist might say there's this other super duper lens you can pay extra for. And it doesn't have anything to do with whether it's a hospital or a clinic. They may offer you this special thing that you can pay extra for, just like sometimes when you go to a hospital, they'll say if you want a room all to yourself, a single room, you can pay extra. There's always things like that available. But the OHIP provided service, the cataract surgery, and the lens that comes with the OHIP provided service is still provided with your OHIP card, just like in a hospital. It doesn't make any difference. So again, I think it's a little bit misleading to people. The important thing is if somebody's going to have a cataract surgery, they should have that conversation with the doctor before they go for the surgery about what lens they're going to have and whether they need to pay extra. And then they can decide with all the information available to them as to what the best thing is for them.
MPP Robin, I was interviewing MPP Sabawi from Mississauga in Wales, and I touched on this same point. And I told them علشان الناس تبقى مرتاحة وهي رايحة لازم انتوا كحكومة تنشروا وتكرروا النشر الكرايتيريا اللي انت رايح تاخدها. يعني انت لغاية الحد دهوت انت مغطى، بعد كده انت مطالب سواء احنا عندنا او في المستشفيات بتاعتنا او في المراكز الخاصة، لان الناس هنا بتدلي بدلوها بطريقة احيانا بتكون مش واضحة كتير.
وعشان كده احنا مستضيفين حضرتك النهارده اللي احنا عايزين نفهم الناس ان العملية والبيزكس بتاع العملية كل الحاجات اللي هي ستاندرد متغطية.
Just to put people on the clear, why don't you suggest to the government to put a guidelines? Guys, OHIP covers a lens at the cost of so maximum, which is good for eyes and according to Canadian specifications and whatever. But if you want to go to an extra let's say standards or codes or whatever, you will be paying the difference. Why don't we put this guideline just to make people aware what they are doing, how much they will be charged extra, the difference, and just, sorry to say, to shut down whoever is trying to play with words.
Right. Well, it's a good point. And my understanding is that doctors need to post that information in their clinics and in their hospitals where they're servicing patients for cataract surgeries. And so it's already available. It's a little bit hard to, because eye technology is actually one of the most advanced areas for new things, new technology. It's probably hard to keep up with every available new lens. But the basic information should be available to everybody. And that's why I would encourage people to have that conversation with the ophthalmologist before the surgery so that there's no surprises and nobody feels that they're under pressure. You will be able to get a good lens approved by Canadian standards, etc., because it wouldn't be any other way that OHIP pays for and the surgery. And your ophthalmologist may offer you other things that you can pay extra for, but there's no need to do that.
Thank you so much. أصدقائي في كل مكان على تورونتو، كان هذا هو لقائنا مع MPP روبن مارتن، الأسيستنت لوزيرة الصحة في أونتاريو، وبنشكرها مرة أخرى. Thank you so much.
Thank you. Goodbye.
Bye-bye.